morning, everyone. We're excited you're here. Wait, let me take a picture of this because no one will believe that this many people showed up for a Society of Critical Care introductory meeting. And we are indeed the opening act to this Rockstar program that's going to happen over the next several days. Thank you for showing up. Those of you that knew that we were talking about this new Society of Critical Care Cardiology, welcome. Glad to have you. Those that didn't, please stay. Ask questions. Be provocative. We should have a good time. If we can get my slides, we'll go ahead and get started. I'm going to give a couple just sort of introductory slides to talk about the society, where we came from, where we're going, and then we're really going to get into the meat of the program. 4 different sessions led by some fascinating debates and then some, as I suggested to the panelists, really provocative dialogue around these different subjects. All right, so my slides are up. So welcome to what is the inaugural meeting of the Society of Critical Care Cardiology. So I know I usually am supposed to end my talks with the thank you slide, but I decided, after really reflecting on the last year or so, that we really needed to thank you in the beginning. First of all, thank you for showing up. I had this vision that we'd have 5 people in the audience and I'd be lecturing to them. So we clearly surpassed that. Thank you for being interested in what we have to say. Thank you, of course, to the Houston Shock Symposium, Marwin and the rest of the team for having us here. What a privilege it is to have our first meeting in conjunction with the Houston Shock Symposium. Thank you to the executive board of the Society of Critical Care Cardiology. You'll see them throughout this discussion and actually throughout the Houston Shock Symposium. Ann Gage, Blim Senman, Elliot Miller, David Dudzinski. Thank you for the tireless efforts over the last year, but mainly thank you also to all the stakeholders, all the interested people. So we are coming up on our 1-year birthday. We're about to blow that candle out on the cupcake for the first Society of Critical Care Cardiology meeting. And so I thought I'd reflect on what we've done over the last year. Again, we are a fledgling society born really through a lot of due diligence efforts, probably a year or 2 ago, but really introduced about a year ago. We'll talk about who have been the essential partners just to get us to this point of sustainability, and then we'll talk about what we have planned for the next year. I can't believe we've done this. We started all together, all of you, an inclusive professional society bringing together every and all stakeholders that's interested or involved in the care of critically ill cardiovascular patients, and all committed to promoting and elevating this emerging discipline of critical care cardiology, and included so many different invested stakeholders: critical care cardiologists, general cardiologists, advanced practice providers, heart failure and transplant cardiologists, cardiac surgeons, cardiac anesthesiologists, our pulmonary and critical care medicine colleagues, our anesthesiology colleagues, emergency medicine pharmacists. And then I'll highlight at the bottom corner, the real goal of this professional society was to promote, to elevate, to sponsor young people in our field, emerging faculty members, early career faculty members, trainees and learners. And I hope you guys will most appreciate what we have done to this point and what we intend to do. And it's going to be with your input that we'll be able to take this society to the next level and hopefully sustain it for many years to come. We've cultivated some critical partnerships, pardon the pun, with a number of different professional societies. You can't do this type of stuff alone. We've partnered with our larger cardiovascular societies and other cardiovascular and non-cardiovascular societies, critical care societies across the world. The European Society of Cardiology's Association for Acute Cardiovascular Care has been a pivotal partner. We just concluded a meeting with them in Florence, Italy. SCI, or the Society of Cardiovascular Angiography and Interventions, sort of the test case scenario for interest in the field, particularly with a focus on learners, CCC enthusiasts. We could not have done it without their exceptional lead. CardioNerds. Man, they are a generous group. They've seen interest and value in what we've done and partnered with us on a number of educational initiatives and shared with us many resources and life lessons when it comes to the nitty-gritty of joining or creating a society. You're going to hear from members of the Association of Pulmonary and Critical Care Medicine program directors. These are the program directors that trained many of us, that got us to where we are and are then still pivotal in helping us to advance the field. Our proud home organization of the American College of Cardiology and the Critical Care Cardiology members section with whom we've partnered. And again, I must thank Marwin and the team of Houston Shock Symposium for allowing us to have our inaugural meeting here. And we've collaborated on a number of important events. With the critical care cardiology enthusiasts, we've had monthly virtual journal clubs. We've sponsored a Women in Cardiology networking event and hope to see many, many of those continue throughout the United States. Last year, in 2024, we had our first sort of collaborative meeting in conjunction with Sky Shock, in which we led a 2024 cardiogenic shock team's collaborative think tank. We look forward to doing another version of that this year in collaboration with the Sky, and then we've been writing. Like, no one knows what we're doing unless we write about it, unless we publish it, unless we share it. And many people in this room have been co-authors on a number of the papers. In Dr. Jumain's journal, the Journal of Shock and Hemodynamics, we had our first society paper, the why, the who, and how, sort of the nitty-gritty around the initial launch of the society. We have recently submitted a joint collaborative paper on behalf of all of the council leads of the Society of Critical Care Cardiology, really focused this time on the rationale, blueprint, and all the lessons we've learned, the good lessons, the painful lessons of starting a new society, so that we can share that with others that may be wanting to start a society for their emerging discipline. We're working on a proceedings paper from the cardiogenic shock team think tank. That's in preparation. And we really hope that the results of this meeting, our first inaugural meeting, will be published and shared with the community at large. And we partnered with industry. You know, we started this society, with about $75 in our bank account. We survived and thrived with $75 in our bank account for the first year, but now we're getting an influx from a number of industry partners. It's critical for our mission and for the sustainability of our society. Here's a number of the industry partners that have worked with us on a variety of different things. I will highlight Zoll, which was helpful in so many ways, was responsible for our meet and greet last night. It was great to see and meet all of you last night, and has been responsible for a number of the educational initiatives we've done. So shout out to Zoll. They are really one of a kind. And Chiesi. Many members of Chiesi are here. They were our first corporate sponsor from the society. They took our bank account from $75 to a little more than $75. So thank you, Chiesi, and we hope to partner with many others. We've also created and empowered 14 individual society councils. We've reached out to our colleagues in the pre-hospital setting and in the emergency department to discuss opportunities for future partnerships. A group that has been critical to the care of our cardiovascular intensive care unit patients, but in whom we've not leveraged that partnership in ways that I think are absolutely necessary for the care of these patients. For those of you who have signed up on the website, and for those of you who haven't, please sign up. It's free of charge. You get, with that free of charge membership, a presidential message from me every month. I know there's probably one or two of you besides my mom that's read it. I work really hard on that. I hope that's been helpful. We've got partnership with our legal team who's helping to continue the legal work necessary to ensure that we have a durable nonprofit status. And we have all in the society gotten really good at hustling. Man, we hustle for money. We hustle for educational experience. We hustle for a spot on the stage of such a brilliant events like the Houston Shock Symposium. So what's next? Well, we'll have the second cardiogenic shock team think tank in conjunction with Sky Shock this fall. We have some webinars going on, this one in collaboration with the ACC's Critical Care Cardiology members section, a two-part series focusing on wellness and humanity in critical care. You can see some of the amazing people that are going to be part of the panel, and it's going to be really a patient-focused session. Part 2 will be a physician or clinician-focused session, and that will come in June of 2025. We are doing a quarterly transatlantic case conference that will begin in September with our European colleagues in the ACVC. We will be sponsoring the 5th annual NYU Critical Care Cardiology Symposium in part, an event led by Jim Horowitz, Carlos Alvear, and others that has been instrumental to our field. We'll be partnering with the third annual University of Minnesota Critical Care Cardiology Education Summit, where we're helping to sponsor travel for 3 APPs and 3 trainees. And if interested, Kat Lee is here. She can talk to you a little bit about a cardiology or cardiac critical care mentorship program that we're going to be doing in partnership with the Minnesota team. That should be quite exciting. Stay tuned for Society of Critical Care Cardiology pre-rounds, little bite-sized cardiology topics delivered in a podcast format that you can listen to on your way from the parking garage to rounds to give you real insights onto what you're about to see in the cardiac intensive care unit and so much more. And we're open to many suggestions from all of you. So in conclusion, I want to thank you, all of you. Thank you for showing up here and not leaving us with a completely empty room. Thank you especially to Marwin, Neha, the team, all the organizers and sponsors of the Houston Shock Symposium. Thank you for your generosity in allowing us here.